Was heavier, full of water, but it creeped up on me so slow. It was so gradual. I just really didn't understand what was going on, you know, it's so gradual. And then when it hit me, it let me know that it was there.
74-year-old Ed Ward was having a hard time doing normal tasks like yard work. Suddenly, walking became too much for him. He chalked it up to being a little out of shape, but it was much worse. After several rounds of tests, Ward was diagnosed with functional mitral regurgitation, commonly known as FMR or leaky valve.
I didn't sleep for 3 weeks.
Why?
Afraid to. Didn't think I'd wake up.
There is no cure for heart failure or FMR, and about half of the people who develop heart failure die within the first 5 years of diagnosis. Ward was immediately referred to the structural heart team at the University of Washington.
When he was referred to me back in the fall, he was having what we call class 3, class 4 heart failure, meaning that he can only walk about 20 feet before he got short of breath, had to stop. So very limiting for him.
The combination of his age and heart failure made him a high risk for conventional heart surgery.
After we tuned him up medically, he was probably in a reasonable condition to be considered for surgery, but was still high risk. And the problem with just fixing the valve without fixing the ventricular problem would not be solved with surgery alone.
While surgery wasn't preferred, Ward did turn out to be the perfect patient to participate in a national study for a device called AccuCinch. Here's how it works. Doctors thread a catheter, a small tube, through a vein from the groin and into the heart. A collar-like device designed with a cable and a series of anchors is put in place, then tightened to cinch the enlarged portion of the heart like a belt. It decreases the size of the heart, easing symptoms, and also strengthens the heart.
Climbing a flight of stairs without stopping. Not at all limited, slightly limited, not at all.
Only a month after surgery, all of Ward's symptoms are gone.
It's nice to have full breath.
Yeah!
AccuCinch is still in the test phase, but doctors believe they're just scratching the surface with this new technology.
Once we discovered a technology that was effective, we started realizing there were a lot of patients sitting in nursing homes or who were on hospice or who weren't even seeing a physician because they were told they had no options. And there are a lot of these patients who would come out of the woodwork, so to speak, that we can offer benefit to.
And while Ward is feeling back like his old self, he still feels young at heart.
I'm going to be 75 years old, so I guess you could say I'm up there. But, it's not so bad that I haven't got another 5 or 10 in me at least. And I feel too good to think that I'm over the hill. I would never think that yet. But anyway, I'm having a good time with it because I feel so good. So.
Dr. Don believes within 10 years, this procedure will be as commonplace as the cardiac stents that are used to treat patients with blocked arteries. UW Medicine is currently enrolling new patients and will evaluate anyone who they feel could benefit from participating in the study. We'll have a link to that study on our website. For HealthLink, I'm Amity Addrisi.